My name is Dr. Elizabeth Hernandez, and I serve as the Interim Deputy Chief Administrative Officer for the county's Health and Human Services Agency. Before we get started, I want to provide a little bit of background on this wonderful annual event. The County of San Diego started the Love Your Heart campaign in response to what was at that time our region's leading cause of death, heart disease. Heart disease can be a tricky one to identify, but one of the best signs is high blood pressure. With that in mind, 15 years ago, our effort to take a campaign to San Diegans began. An indispensable key to our success has been and remains the incredible grassroots efforts of our partners, particularly in under-resourced areas of our community. Because of the incredible volunteers and partners who have helped spread the word over the years, I'm proud to say that since 2011, Love Your Heart has helped screen the blood pressure of more than 500,000 people across the San Diego region and Mexico. Many of those outstanding partners are here today. Community organizations have hosted blood pressure screening sites at churches and neighborhood centers. Blood pressure conversations were held in schools, boardrooms, and barbershops to dispel stigma. Together, these efforts made it possible for us to transform a county where heart disease is not the leading cause of death. We celebrate our success, but know much remains to get done. Heart disease continues to rank second in our region as a cause of death. More concerning, the number of people diagnosed with heart disease is on the rise. This makes our mission and message even more crucial. So we come together again on the week before Valentine's Day to encourage everyone to know their numbers. We have a prestigious lineup of speakers today, including the California Surgeon General, Dr. Diana Ramos, County Public Health Officer, Dr. Sayon Thihololi Pavin, Barbara Jimenez from the U.S.-Mexico Border Health Commission, and Ernesto Villanueva from the American Heart Association. First, it is my honor to introduce our County Board of Supervisors Vice Chair, Supervisor Montgomery Stepp, who has been a great champion of community health throughout her career.
Good morning, everyone. Thank you so much, Dr. Hernandez, for the introduction. And I want to thank everyone who took the time out to be here today. It is such an important topic and one, no pun intended, that's very near and dear to my heart. I'm proud to say that Love Your Heart 2026 officially starts today. Appropriately, it runs through Valentine's Day, Saturday, February 14th. Valentine's Day is a perfect reminder to not only spread love to those in your life, but also to think about your heart health. From our doctors, we know the percentage of adults who had heart disease in San Diego went up from 6.9% in 2023 to 7.6% in 2024. That increase may not sound like a lot, but it means that 20,000 more people were diagnosed with this deadly disease. This is why the county and our partners remain steadfast in our commitment to provide free blood pressure checks at locations across San Diego County and Mexico. We have blood pressure screening sites in all of our districts and are focusing, as we do each year, on priority zip codes where health disparities are highest. These are the communities most disproportionately affected by health challenges. Current data shows that non-Hispanic Black residents face the greatest burden with heart disease. Their hospitalization rate is 737.5 per 100,000, which is 1.5 times higher than any other group. The data highlights both the persistent health disparities and the need for culturally tailored prevention efforts. So please go get your blood pressure checked in your neighborhood and bring a loved one with you. It only takes 5 minutes. You may be surprised at what you find, or leave with a little extra confidence in your health. Both of those are good outcomes. Finding a location near you is quick and convenient. LoveYourHeartSD.org has an interactive map where you can see the list. The county's efforts to support healthy, thriving communities have inspired colleagues beyond our borders. I want to take a moment to acknowledge our incredible partners in Mexico. You will soon hear more about that partnership from Dr. Rangel Gomez. She is the Executive Secretary of the U.S.-Mexico Border Health Commission Mexican Section. But first, I want to introduce Dr. Sayon. Dr. Sayon is our county public health officer. Let me say that one more time because that's important. Dr. Sayon is our county public health officer, and we are very, very grateful to have Dr. Sayon. He will come up and talk about how important screenings are for our community's health and well-being.
Good morning, everyone, and thank you so much, Vice Chair Montgomery Stepp. Education events like these are an important part of the equation to save lives. Heart disease remains one of the leading causes of death in the U.S. and the leading cause of death in the U.S. and in California. But here in San Diego County, as you heard, it is the #2 leading cause of death, thanks to efforts like this. And it continues to account for about 1 in 5 deaths per year in San Diego. When we look deeper into the data, like the supervisor had mentioned, high blood pressure is a central piece of the puzzle. Conditions linked to high blood pressure include heart disease, stroke, diabetes, and kidney disease. These repeatedly show up as leading causes of death in San Diego across the entire region. So what can we do to stay healthy and live longer? First, know your blood pressure numbers. We have a poster over there with the average healthy ranges for most adults. Second, by making small lifestyle changes, you can take control of your health. Simple steps like taking a quick walk every day, choosing to take the stairs, eating more leafy green vegetables and fruits, quitting smoking and vaping all help. And these messages have been championed for years and more than a decade, like you heard Dr. Hernandez say, here in San Diego with Love Your Heart, and not only in San Diego, but across our region and with our binational neighbors in Mexico who believe in the power of Love Your Heart. So lastly, I wanted to share some great news that early data suggests that the life expectancy for San Diegans is continuing to rise from 81 years to 81.5 years in our latest available data, yet we know there are significant differences when looking across the region and factors like sex, race, ethnicity, and geography. And this is why we used Health Disparities Grant Funds to purchase over 1,300 blood pressure monitors to distribute via our partners to high priority zip codes at their Love Your Heart events. And to speak more about the impact of Love Your Heart across our region, I'm beyond grateful to introduce our California Surgeon General, Dr. Diana Ramos.
Thank you, Dr. Sayon. Buenos dias, good morning. Thank you so much, everyone, for being here to really help us celebrate and kick off the San Diego's Love Your Heart campaign. San Diego, you are leading California in demonstrating how public health really takes charge. This is really the culmination of prevention because you're showing that identifying what your blood pressure is accessible. It's community driven, and more important, you are empowering people to help improve their own lives. By providing the free blood pressure screenings throughout San Diego, Love Your Heart helps individuals learn one of the most important indicators of their health and take action before serious disease develops. We've heard the statistics of how cardiovascular disease is impacting the lives of Californians, impacting the lives of San Diegans here. A healthy heart is one of the strongest foundations for lifelong health. That's why this initiative is so important. Cardiovascular health influences brain health, pregnancy outcomes, kidney function, metabolic health, early health, all of these things. When we protect our heart, we are protecting our lives for the rest of our future. And one of the most powerful and oftentimes overlooked opportunities to improve lifelong health occurs during pregnancy. Yes, pregnancy. And I would be remiss as an obstetrician gynecologist if I didn't highlight that. Pregnancy represents a critical life course moment. During pregnancy, the cardiovascular system undergoes profound changes. Blood volume increases, cardiac output rises, and the heart works harder to support both the mom and the baby. Because of these changes, pregnancy can reveal underlying cardiovascular risk like high blood pressure, diabetes, metabolic disease that might otherwise remain undetected. These pregnancy related conditions are not isolated events. They are early warning signs, and really, they are a call to action for us to be able to take care of our health. It is so critically important that we know the status of our health now and not wait until we're sick, not wait until we become pregnant. We need to know now to be proactive and take early action. That's why Love Your Heart San Diego is so critically important, and it really is a call to action for everyone. I am so impressed by all of the partners throughout the county that have been pulled in and, more importantly, are stepping up and providing the education that can really change lives. We have to remember and we have to take into consideration also that San Diego is a border health county. And here, this is one of the largest and most dynamic binational regions in the world. I am so impressed by the partnerships that have been established here with San Diego and the border counties and the border communities. Families oftentimes live, work, and seek health care across our border. And this border cross movement highlights the importance of coordinated prevention strategies, culturally and linguistic appropriate services, and strong partnerships with community-based and binational health organizations. So thank you, San Diego. Thank you for being so proactive, so reaching out mano a mano, because we are really one community, and it is so critically important to make sure that all of us are healthy. The Love Your Heart campaign exemplifies how community-based prevention supports life course health by encouraging individuals to know their blood pressure numbers before pregnancy, during pregnancy, after delivery, and throughout adulthood. Your campaign strengthens cardiovascular health across generation. To our healthcare providers and our health teams, I encourage you to recognize the opportunities that we have not only now at this moment, but before pregnancy and beyond, to connect our families and support the health of our moms and our families. And to our community partners, thank you so much for sharing the great work and for being the voices to make sure that all of San Diegans and Californians are the healthiest they can be. Let's continue together in health. Juntos en salud. Thank you so much for the amazing work that is being done here in San Diego.
Buenos días, ¿cómo estamos? Good morning, everyone. Agradezco sinceramente la invitación. Es un honor dirigirme a ustedes, a todas y todos ustedes el día de hoy. Good morning, everyone. My name is Barbara Jimenez, and I serve as the Executive Project Coordinator for Binational Initiatives for the U.S.-Mexico Border Health Commission, Mexico Section. And it's an honor to be here today on behalf of the Commission, and Dr. Gudelia Rangel, who is our Executive Secretary of the Commission, Mexico Section, sends her warmest regards. Our Ama Tu Corazón, you've heard a little bit about it, pero es un componente binacional de la campaña Love Your Heart. Está alineado con la misión de la Comisión, mejorar la salud, calidad de vida y a lo largo de la frontera mediante esfuerzos binacionales, multisectorales y basado en evidencia. Las enfermedades del corazón siguen siendo la principal causa de muerte en México, incluyendo los 6 estados fronterizos, lo que resalta la importancia de nuestra colaboración. This year marks 12 years of sustained binational collaboration with the County of San Diego's Health and Human Services Agency through the Ama Tu Corazón initiative, which is aligned with the Love Your Heart campaign, to advance heart health on both sides of the border. We are united by a shared commitment of prevention. This partnership really empowers individuals, as you heard earlier today, in knowing their numbers by providing those free blood pressure screenings. This long-standing binational partnership demonstrates the power of cross-border collaboration to expand reach, strengthen prevention efforts, and reduce cardiovascular disease in border communities. Tras más de una década de compromiso, los esfuerzos binacionales han ido más allá de la región fronteriza, logrando una expansión sin precedentes a través de la red de consulados de México en Estados Unidos y en sus ventanillas de salud. After more than a decade, Ama Tu Corazón has expanded beyond the border through the Mexican Consular Network and Ventanillas de Salud. This initiative now reaches residents not only on the U.S.-Mexico border, but well beyond to Mexico and the U.S. La campaña 2025 es un claro ejemplo de cómo cada año removemos nuestros compromisos para ampliar el alcance, para fortalecer la conciencia en salud. Es muy importante la educación a nuestra población. In 2025, Ama Tu Corazón campaign achieved remarkable outreach, providing free blood pressure screenings to over 55,000 participants across 261 sites throughout the U.S.-Mexico border region. En 2025, más de 45% con presión arterial elevada recibieron detección, orientación y educación oportuna. Es muy importante que nada más no es recibir la detección, es importante la orientación y la educación oportuna, la conexión a los recursos. So in 2025, more than 45% of those that we provided the blood pressure screenings identified with elevated blood pressure and received timely screenings, education, and guidance. And again, it's not just the screening, it's that connection to the resources, it's the education, and it's the importance of understanding why this is key. Este 2026 se tiene programado más de 400 módulos en estados fronterizos mexicanos, incluyendo más de 35 ventanillas de salud. So in 2026, we will continue to expand the reach, with over 400 sites planned across not only our Mexican border states, but over 35 ventanillas de salud. We've expanded into Massachusetts, Colorado, Indiana, New Mexico, Georgia, North Carolina, New York, Nevada, Wisconsin, and Ontario and Quebec in Canada. The expansion to these multiple additional sites across U.S., the states, and Canada reflects our commitment, our strength, and our impact of this campaign. Cada año, la campaña fortalece la recolección de datos. Como acabamos de escuchar de doctora Ramos, es muy importante que también estemos haciendo un programa de educación para las mujeres embarazadas. Esto nos permite detectar hipertensión, facilitar referencias médicas tempranos y prevenir complicaciones. Cada año trabajamos con la población para compartir la importancia de conocer sus números. Cada nuestro de los coordinadores en todos nuestros estados están haciendo cosas muy para jalar a la comunidad, como se dice. Estamos haciendo actividades como caminatas, yoga, cocina saludable, todo para asegurar que nuestra población vienen y conozcan sus números. The Ama Tu Corazón campaign would not be possible without the support and collaboration of strategic partners committed to implementing actions that not only increase and improve the health along our U.S.-Mexico border, but along both the United States and Mexico. I'd like to thank our coordinators in the U.S.-Mexico Border Health Commission Mexico section in each of the border states for their tremendous work in the community, including the education and the connecting of resources for our community. I also just like to take a minute to thank our partners here today from Mexico. We have Dr. Loera, Dr. Acota, and Dr. Kevin Cerrillo. I would just like to make sure that we also recognize the importance of this close binational program, initiative, impactful opportunity between the County of San Diego and the U.S.-Mexico Border Health Commission Mexico section. I'd also like just to give a quick shout out to the Health and Human Services team, Janet Barragan, Elena Quintanar, and Cassie Castañeda, plus everyone behind the scenes that I know do an amazing job And I've just been extremely proud to have led this campaign since 2015 in both countries. And I'd like to especially thank the leadership and partnership of the County of San Diego, our Vice Chair Montgomery Stepp, Dr. Hernandez and Dr. Sayon with HHSA, and appreciation to our special guests today, Dr. Ramos and Dr. Ernesto Villanueva. Finalmente agradezco la invitación. Vuelvo a asegurar que nuestro compromiso de seguir trabajando de manera conjunta por la salud y el bienestar de nuestras comunidades sigue en marcha, sigue en el plan de trabajo de nosotros. Estamos aquí trabajando juntos y les damos las gracias y les vuelvo a asegurar que aquí estamos con nuestro compromiso en fuerte. And next, I'd like to turn it over to Dr. Villanueva. Nice to see you again, Dr. Villanueva, from American Heart Association. Muchas gracias.
Thank you. Muchas gracias. Great to see you as well, Doctora Jimenez. Good morning, everyone. Buenos dias. I'm Ernesto Delgado Villanueva. I am privileged to serve as a member of the American Heart Association San Diego Board of Directors. At the American Heart Association, we work to be a relentless force for a world of longer, healthier lives. To improve and extend people's lives, we fund research, advocate, and serve as a catalyst for achieving maximum impact in equitable health and well-being. One of the Heart Association's focus areas is stroke. Stroke is the fifth leading cause of death and a leading cause of serious long-term disability in the United States. Despite stroke being largely preventable, treatable, and beatable, each year approximately 800,000 people in the U.S. have a stroke. 800,000 people. A stroke happens when normal blood flow in the brain is interrupted. When parts of the brain do not get the oxygen-rich blood they need, those cells die. High blood pressure is the leading risk factor for stroke. Lowering your blood pressure cuts that risk. That's why it's so important that people have their blood pressure checked regularly. This includes people in all ages, children, young adults, and adults. Basically, bottom line, everyone. The American Heart Association is working to help people whose doctors recommend regular blood pressure checks by making sure they have access to these life-saving tools. We team up with local clinics to supply them with blood pressure monitors and the latest health information for patients. A new initiative we just launched is the Libraries with Heart program. This program is at several San Diego City public locations. The way it works is that people can check out a blood pressure monitoring kit. Each kit includes a clinically validated blood pressure device along with educational handouts in English and other languages such as Spanish, Arabic, Tagalog, Korean, traditional Chinese, and Hindi. Blood pressure tracking sheets and referrals to community resources are also provided. County libraries help us reach the public through promotions and events, with some branches offering staff blood pressure and monitoring stations. And the Valley Center branch is hosting its 4th Love Your Heart Community Fair on Valentine's Day. Now tell me, where else would you want to be, at least for part of your Valentine's Day, than there? So it's on my calendar. We encourage everyone to exercise healthy lifestyle behaviors such as good nutrition, not smoking, and being physically active. Thank you for helping the American Heart Association continue to advance health and hope for everyone, everywhere. Thank you again. Muchas gracias. Please welcome back Dr. Hernandez. Thank you.
Again, I would like to thank all of our incredible speakers today for shining light on such an important topic. As they've said, remember, 5 minutes can save you or your loved one's life. Please get your blood pressure checked and know what your numbers mean. Now that we're all gathered today, we're going to take a quick picture. And afterward, our speakers will be available for one-on-one interviews, and anyone can get their blood pressure checked today as well. So thank you again.